Hi everybody, this is Dr. Rahul Kaul. I'm an orthopedic spine surgeon and I'm associated with Sharda Hospital, which is one of the very premier tertiary care hospitals, and it is in Greater Noida, Uttar Pradesh. So today I'll be giving you a brief talk on the topic with regard to the spine issues and its treatment options. So commonly, there is nobody, I would say, that who has not suffered from a back pain or a neck pain any part of his life, which is a very, it's as common as a common cold. And lot many times, because I am getting the patients, even the young patients, who are having these issues now, especially among the IT professionals. Sports person definitely are, but IT professionals, they are having a very common these neck pain, back pains, and apart from the old age or the geriatric patients who are having these problems. So in brief, if I tell you on a scientific basis, that what can be the common causes for your back or neck pain, if I enumerate them, we have grossly, classified them into something what is a common entity which is known as a mechanical pain. Now, what is the mechanical pain? Because of the age-related changes, as the degenerative changes start happening, so your muscles, they are not fully functional. The changes are happening in the joints. The fluid, in a layman language, the fluid which is known as the disc tissue, it also degenerates, and as a result of which all these things which are happening, these things will start creeping up and they result into the neck or the back pain. And as I told you, the mechanical, meaning something which is related to the activity, maybe too much strenuous work, some lifting of some heavy weight. So these issues sometimes can cause these problems, and with a period of rest and all, it improves. It may have off and on, it can again develop, recur, but most of the time with the management or conservative treatment, it really gets relieved. Then what can be the other reasons? There can be a major trauma which can result into the back pain, something very severe which has caused a disruption of the spinal structures. And this damage can persist and can result into back pain which can be prolonged. Then there can be the infective pathology, meaning there is some kind of infection, like in our Indian scenario we commonly find a very common infection, that is the tuberculosis. So it results into the damaging of the spinal structures, and to the extent that it can even cause the neurological deficit, meaning the weakness in the upper limb, the lower limbs, because it presses the spinal nerve tissue, as a result of which it can be a very disastrous thing. Then there can be the inflammation, or what we say the arthritic conditions. Apart from involvement of other major joints, the spine is also getting involved. So it can have a different kind of presentation. And finally, sometimes, as in other parts of the body, you can have some tumorous or the cancer which is involving the spine area, and that can result into the back pain. So, but commonly what I see in my practice, and what is a very common thing, is a mechanical pain, and another thing is old age, old age, especially with regard to the females. As a female achieves her menopause, that results into the decline of a rapid decline in the bone mass because of the changes in the hormonal levels, and the entity what is known as the osteoporosis, because spine is a very common area which is getting involved in the osteoporosis, and the bones, they are not able to sustain the normal physiological loads, because of which they start creeping or getting depressed, fractures and all those, with a very slight simple activities also, and that can result into a severe pain, and the patient would lot many times get bedridden, and these old age patients, they are very fragile patients. So there can be n number of causes, but these are some brief important causes what we see. And as I told you, let me discuss the mechanical, because that is something, the lifestyle has changed, more into the holding of the mobiles, laptops, the IT professional I was talking about. So that, a simple layman, my statement will be that two things are very, disastrous of the point. I would say they have a very major impact on your neck and the back, which are the mobile segments, the mobile area of your back, because there is the lower back and the neck. So having a very abnormal posture and sitting for prolonged time, sitting is something which aggravates the back pain a lot, and you are not maintaining a proper posture, that also aggravates your back pain or the neck pain. And more importantly, as the life has become so hectic, people don't find time for some kind of physical activity, because a physical activity is a very crux to improve these conditions, because if in a layman language, if I say a spine I take it as a pillar, then the muscles which are holding that pillar, they're like a rope, they are very important. So with age, with passing on time, changes are bound to happen within the spine region. The disc is going to degenerate, the joints are going to degenerate. This is an inevitable thing. Nobody can change it. But if we are able to maintain the strength of our back muscles, what a layman will be like a rope. If the rope is very strong, it will reduce the amount of impact which will be happening on that pillar or the column. So to almost all my patients, who are presenting, and I'm very, I tell them that follow some kind of physical regime, and a very easy thing is a normal walk. A normal walk is enough. If you are able to sustain that, being consistent on that, it can make a great impact with regard to all these conditions. A normal walk for say half an hour or roughly 45 minutes. A rough guideline maybe at somewhere around 4 to 5 kilometers. So you can have a smartwatch, just have it the smartwatch and start walking, maybe around 10 to 12,000 steps. A rough idea or guideline. But be consistent, and very importantly, follow it religiously. That is the crux. There are a number of interventions that may be required. Medication may be there, other things may be, but for the long-term measures, this is one of the very important things. One, to maintain some kind of physical activity in your routine, and more importantly, maintaining a proper posture. Avoid sitting for prolonged time, especially, as I told you, the IT professionals working on the laptops and all, they can't maintain their posture and they have to sit for a very long time. So there's a very common entity what I see in those patients, the neck pain or the back pain. So what I tell them that, okay, what you can do, because in such scenario, the desktop is somewhat like the ideal, because the moment your monitor goes up, your neck will be straight, because in sitting on a laptop, you always have to maintain that crouching posture, neck down, back not maintaining the proper posture. So these things aggravate. So if you raise the platform of your laptop and take a keyboard, a USB or a Bluetooth keyboard along with that, then same the way, because nowadays nobody can carry a desktop everywhere. Desktop is not possible and it's getting a little outdated. So laptop is more convenient. So just making few changes in these, that can make a hell of a difference. So my suggestion is to all my patients is that, and that is the crux. So, and with regard to the, especially the old age, once the female achieves menopause, I always tell, because you need to have started the supplements. That's because the bone mass is going to decline. So supplements in the form of some calcium supplements, vitamin D supplements. There are additional measures also, but at least these basic things they need to take it religiously. And apart from that, again, the same thing holds for them also, because maintaining a good or a daily base of physical activity, because that physical activity, apart from strengthening the muscles, it is going to maintain the bone mass, the bone strength, especially with regard to your spine, and you will have less problems. So that crux, long-term measure, some kind of physical activity which within your comfort zone. Don't try to overdo that, but within your comfort zone, definitely maintain it. That is the crux. So this is my humble and earnest advice to all my patients who come to me, that follow some kind of physical activity or some physical regime on a daily basis. Any queries? Okay. So and apart from that, those who there are some things which are spine, everybody, apart from always some majority of the people have that fear, that if this is going to happen, then what and what. So, see, a normal entity, a back pain or a neck pain, you never have to get so worried, because as I told you, it's more of a mechanical. Most of the times, with the passing time and the conservative treatment, in the form of some pain management medication, some physiotherapy, that gets relieved. But I would try to highlight some red flag signs. Now, what are in the red flag? That if those entity or those signs or those symptoms you are having, then it is better that you should always consult the specialist. Now, one of the things would be that, see, anything with a pain, which may be a neck pain or a back pain or whatever, it is progressively increasing. Despite all the, we have given a trial of say 4 to 6 weeks, and it is not getting relieved, and things are not subsiding. Instead, they are progressively increasing, and the condition of the patient is deteriorating. Never take it lightly. Consult the specialist so that we can work up what exactly is causing, so that the things can be taken up at the right time, at the earliest time, so that whatever intervention is required within the time frame, they can be dealt, and the patient can be back again to his routines. Apart from that, any back pain which is associated with a high grade fever, any back pain which starts having the weaknesses in the upper limb, meaning the hand, the upper limb, the lower limbs, which is also progressively increasing, right? So these things also you should never neglect, because one of the entity, as I told you, the neurological deficit which I was talking about, because more it is progressive, that signifies that apart from whatever the changes are happening in spine, the delicate nervous tissue, what we say the spinal cord or the spinal nerves, which are passing through that bony column, they are getting pressed. And the more important thing is that as the weakness or whatever the neurological deficit, more it increases, that then the chances of recovery also, because if we want to intervene, the chances of recovery will depend on what the condition is before the intervention. More the deficit, the prognosis becomes much worse. So that's why whenever you start having these kind of symptoms or signs or whatever I would say, so never try to keep it back up. Always try to consult the specialist, the spine specialist, so that things can be looked after within the time frame, and they can be worked up, and the intervention or any treatment, whatever the right treatment is required, they can be taken up. So one is that, and the more importantly, apart from the weaknesses what I was talking about, sometimes even to the extreme, the patient starts having the problem with his bladder and the bowel. That is something too extreme. Apart from the weaknesses, that is something too extreme. That is something I would say it is one of the emergencies we can consider, because once the bladder and bowel symptoms start happening, that signifies that it is something very severe. And more the severe, as I told you in the beginning only, the more the severity, more the chances that after intervention, how much the improvement will happen, the chances keep on decreasing. So these are few, I would say the red flag signs which you should never neglect. And whenever it happens, because normally, as I told you, back pain or the neck pain, they are a common entity. They can be managed, and most of the time, even without intervention, you take a brief time of rest, change your activity level, that improves. But if it is not happening, don't sit back. Rather, and generally a rough guideline, I would say 4 to 6 weeks. Despite taking all those medication, conservative, physio, and all, and it is not improving, don't sit back. Try to consult a specialist at the earliest, so that whatever the things are there, it can be sorted out, worked up, and whatever, if intervention is required, whatever, depending on the case to case, that can be taken up appropriately at the right time, so that we can so that the optimal outcome can be delivered. So these are the things. And yeah, so this is a structure of the spine which I was talking about. So what are the areas? Basically, the spine is starting from below the skull area. We have the cervical spine, what we say, the neck portion. So we have 7 vertebral bodies there. Then we have the thorax, the area which is covered by the ribs on the sides. Okay, so there are 12 thoracic vertebrae or the bones, and then the lower down is the lumbar spine or with the back, where we have the 5 vertebrae, right? So the neck and the back, as they are very mobile, anything which is very mobile, it will always have a tendency to degenerate faster, right? So neck and back pain are a little commoner than in comparison to your to the mid back region, because it has the structures which are there, especially the rib cage and all, it provides a good stability. No doubt it can also get involved, I'm not saying that, but common entity will be the neck pain or the back pain. So these are the things, just to give you a brief idea that what is anatomy. And as you can see, the main, the within this bony column, the main structure, what we say the spinal cord, that passes, and at every level the nerves, which are going to supply the particular area, at every level the nerves are coming out and they are going to supply the particular area. So this is in brief about the structural components of the spine. And apart from the some of the good, I would say the sitting posture I was telling you in a brief. So whenever you try, especially the students, nowadays the exams are coming up, and those chaps also I find very common in my OPDs. They have a habit of tendency to sit on those, crouching posture, sitting on the laid back sofas, your beds and all. So these things, if you keep on doing it for a prolonged time, they result into these back pain, neck pain. So again, whenever, especially when you are sitting for for your preparations, for your exams, preferably you should sit on using a chair and a table, right? And when you are sitting, sit a little reclined so that your lower back touches the back of the chair to provide that support. But again, the same thing, if I have to study something in front, and if I am sitting lean back, it may be difficult for me to have a proper vision. So on the table you can have those inclines, what we say, those platforms which we get online also. So if there is a platform in front of my table, my book will be in front, and I can sit comfortably with my neck straight, my back supported, and I can, because the book is, or whatever the material I am studying, that's near to me, and I can maintain my posture and also do my work. So sitting, especially for the students, for the IT professionals, that is, this posture maintaining is very important. And another thing, that avoid, as I was telling you, avoid sitting prolonged. Now what I mean by that, see, you sit for 10 hours, 12 hours, that is not a big deal. But only thing is, avoid sitting at a stretch for long. Meaning after every 45 minutes to 1 hour, give a 5 minutes halt, just stand up, just roam around or do whatever work you want to do, and then again sit up. Because as you are giving these breaks, so these breaks help your body to come back. But if you are going to continue that for a very long, especially like, most of the time, lot many times, the patient comes up, we had a long drive, and then following that, after 2 days, the back pain. So again, same thing. If you are having a long drive, just after 1 hour or so, give a halt, get out of the car or a vehicle, just, roam around a little or just walk a little bit, whatever you want to do. And then again, you continue with that, because this will help you, these small tidbits, although it seems to be very simple, they are fine, but that helps in getting those recovery or that thing back, and decreases the incidence or the chances that, see, nothing is perfect. It's not that if you are going to do, you will never get a back pain or other. But these are somewhat the measures which, with the time, I would say, with the research and all, and so these are somewhat tested, that if we are avoiding the prolonged sitting, maintaining proper posture, the incidence of you or anybody getting those back pains or neck pains can be reduced to a great extent. And apart from that, as I told you, the physical activity, be regular with your physical activity. So that is something very important. So these are the measures which should be taken, and it's all, I would say, it's in your mind. That lazy attitude has to be given away. After a certain time, everybody needs to be, active, and just spending a half an hour or 40 minutes for your own body, everybody can manage it, despite how whatever the means is there with you, but taking a small part of a time for your body, it is very important. So these are the things which I want to highlight. And any queries?
Yes. So we have one query from Mr. Sudeep Podel from Nepal.
So, Mr. Sudeep, I was going through a query with regard to the plasma therapy. See, frankly, I don't have any hesitation in saying that I have never, used these interventions, because I believe more in ethical practice and something which is scientifically related. There are n number of modalities which are, they're available in the market, but whatever those who are doing, genuinely, they do things based on some scientific evidence, or what we say, the evidence-based management. So the plasma, then the ozone, and these, most of the times what you have talked about your disc problem, as I told you, most of the times with passing on time with the conservative management, they get relief if you take proper medications and all those things. If not, then in my practice, what I follow is the plan B. At those particular, depending on wherever the disc which has protruded, at that portion, we can give you some nerve blocks. That also helps, because the medication is directly at the spot where the problem lies. So we can give you a higher medication, the effect is more, and to a great extent, it helps in improving the problem, because it is the leg pain. I hope the leg pain will be bothering you too much if the problem is there. But if these modalities also fail, it's not, nothing is sure, nothing is, So if these modalities, after all those things which we have tried, then if the things are not working up, then I would suggest, this is what the guidelines say, after 8 to 12 weeks, the conservative trials have, the conservative treatment modalities, the nerve root injections and all those, they have failed. They are not improving your condition, then better to go for a surgical intervention rather than these, which can be of different, depending on the expertise of the surgeon and the center where it is happening. Now we are at our center, we are doing it the minimal invasive with the endoscopy, which causes the very less collateral damage. The recovery is fast, short-term recovery, everything is fast. The other aspects, the infection, the possibilities of the neurological deficit and all those, because you are seeing it under magnification. So depending on the case, center. So finally, if these conservative measures have failed, my suggestion will be go for the surgical intervention. Rather than these hanky-fanky things, the plasma, ozone, which have not been proven. Day in and out, new things are coming up in the market, but research proven, which somebody can, document that, okay, this, the trials are not there, which can be convincing that I can say that this plasma and the ozone and all those aspects, that they are very helpful, not very appreciable.
So he is asking the counter question: if I do endoscopic surgery, so will it be cured or remain same? He's asking.
See, definitely, the idea. See, first and foremost, endoscopic surgery is not different from the routine surgery. The idea of surgery is that the pathology or the thing which is causing a problem, that can be dealt by different modalities. Only thing what endoscopy or the one minimal invasive helps is that the collateral damage. Now what I mean by collateral, because if you have to go inside, as you are minimizing the damage to the soft tissue structures like the muscles, the ligaments, so that is the advantage of the endoscopic. And as the endoscopic is done under the water medium, so chances of infection are very less. So that these advantages help us to have a faster recovery for the patient. But the main thing which is bothering you, the disc which is protruded out and causing the nerve, that has to be removed. There are different methodologies, but definitely the MIS or the endoscopic has proven that the short term of the recovery is faster, and by doing this endoscopic surgery, definitely you have stand a good chance that the things will improve.
We have one more question, but it's to me. So Suchita Vashni is asking, what are the side effects of knee joint replacement surgery? Any side effect?
See, ma'am, nothing is free in this world. Coming to the knee joint replacement, one of the indication primarily, I would say, is how much it is bothering you in your routines. That is one of the primary indication what I see, because we don't have to treat the X-rays. That is one aspect, no doubt. But more importantly, how much is your activity level? What are your demands? How much you want it from your life? That has a very impact on whether we should go for a surgery or not. Then coming to the disadvantages or the complications, any surgery, there is ample amount of literature that this can happen, and if a surgeon is telling you, this is what I personally follow, that I am telling that is 100% no, nothing comes free. But okay, doing an elective surgery, we need to, what I follow, that do a good pre-op workup, look into all the things which can go haywire, get prepared for it before only, and give your best. And it is a very gratifying surgery, because overall the knee pain, it bothers you to the extent that apart from that physical pain, it is a social pain. You feel that social stigma. You can't go anywhere. You can't get those activities which you want to do that. So definitely it is a very gratifying surgery done in the right patient. The results are very good, and then, as I told you, see, center to center it can vary, the infection or the other complications, they are there, documented, but getting it done at a good center by a good doctor and the right indication, the results are always good. This is my word.
So one more question from Bangladesh. Patient is asking any physical limitation after the spine surgery.
Yeah, that's a very good question. See, physical, as I told you, as we at our center we are doing endoscopics, good number of endoscopic surgeries also. So the short term or the faster recovery, it helps that, you know, on the next day or say within a span of 2 to 3 days, the patient is mobile. So what I suggest my patient is that, because the idea of doing the surgery is not getting you bedridden. The idea of surgery is that I need to make you mobile as fast as possible. That is what my goal is. So start, and then as you are mobile, what my suggestion to my patient is, start walking, so that you can strengthen the muscles of your back, you know, and as you start increasing your activity level gradually. So that keep on doing, so that within a span of say 6 to 8 weeks or 8 to 12 weeks, as you are accustomed, your muscles are strengthened up, then you can gradually keep on building up your activity level and get to your routines, what you were doing prior to your surgery, right?
So one question is from Sudan. Patient is asking what is the duration of the surgery and how early patient can be recovered, like after the surgery.
The spine surgery?
The spine surgery.
See, it depends upon what is the condition, you know, because you can't have one shirt for every person. You know, case to case, you have to make a tailor-made treatment. Depending on the condition, how severe, what is it bothering, how much, it is depending on lot many factors. There can't be one universal statement that, okay, within this span, this outcome is going to come. So, commenting on that, first and foremost, I need to know the details of about what we are talking, rather than, you know, just haywire, okay, no, nothing, you know, because it has to be case to case. Somebody can have different problem with different issues, somebody is having different, so they can't be having the same outcome or the same results or same post-operative course also. So depending on what the condition is, if the surgeon or the treating physician or the surgeon is knowing the details, then only he can comment on that okay, within this span, what will be, how the post-op course or how the recovery is going to be there.
Okay, sir. So last question only. So one patient is asking what are the cervical spine cancer symptoms? How can we identify?
See, cervical
spine.
See, the cancer, it's a very layman type term, you know, about the cancer in the cervical spine. It depends, you know, when we are talking about a cancer, what kind of cancer it is, right? There can be cancers which have originated in the bone of the cervical spine, depending upon the age. Commonly what we see is something which is present elsewhere and it has spread it to the cervical spine, especially the age group, you know, because if it is young, lot many times the entity comes from the cervical spine, but as the age progresses, you know, like for example, somebody is having a prostate cancer, so that cancer has now spread it to the body, other portion, and now it has gone to the cervical spine also. So there can be cancers or the tumors of the nerve tissue also. So there is a wide variety, you know. So as I told you, you know, it has to be case to case, that what is going to happen, what kind of cancer it is, because there can't be a universal statement for everything. Depending on and then the details, you know, once we have something worked up that's done, what is the condition, how it is, then only it can be commented that what can be the things. Thank you. Thanks a lot.